All right. Happy Tuesday, everyone. Thank you so much for joining us on this amazing, beautiful day that we're having. I don't know what's going on, but God is just blessing us with the most amazing weather in Florida. It's not too hot yet, you know.
Nice,
It's
nice.
yeah, we are just like, ooh, even though spending time at the beach, it's still springish. It's really beautiful. So
Have
thank you,
that springish feel on the
springish.
outside.
Yeah.
Uh-huh.
Yes. Thank you for joining us. Welcome back, everyone. My name is Donna Morgan, and I am the president of Caribbean American Diaspora Alliance, president of Women of Culture Incorporated, real estate broker at Florida Summer Homes Realty, and mindset coach at Inner Vibes Consultant. And we want to welcome you to an amazing show tonight. A topic that is needed, more conversation, more understanding. And our topic this evening is understanding autism. So I know there's lots of questions of this autism, and it's kind of like recently, right? I think it's maybe what the last 10 years we're kind of is so prevalent, that we're really talking about it and bringing more awareness to it. So we hope you enjoy our show tonight. So hey, Louis, how are you?
I am well. I'm well, enjoying the weather as well in Central Florida. It's around 78 now on the outside, and beautiful evening, beautiful week. We want to welcome everyone to CRRFM to this edition, Caribbean Diaspora Vibes, and we're discussing a very important topic, as Donna mentioned, autism today. And we want to welcome all our listeners from across the world to this edition this evening. May God bless you, and may you be informed with whatever we have lined up for you.
Yes, and of course we've got Dr. Arlene Adams. How are you?
Great. I agree with both of you. The weather simply gorgeous.
Yes.
Yes. And
Welcome, Doctor.
our co-host, Dr. Bhavan, is not with us. She is just traveling somewhere and living her best life right
Amen.
now. And
Amen.
so we'll be hearing, we'll have her back in soon. But just to let you know, we've got Dominica, right? We don't usually hear a lot from Dominica. So we've got Dominica representing, and they are actually
Pick up. Welcome, welcome. Woo!
they are actually in their country, not from the diaspora. So I'll introduce Christel Pascal, I think is the way to pronounce it. She's a special education teacher at Achievement Learning Center in Dominica. Hello, Christel.
All right. Welcome, Christel.
Thank you for having me.
All right.
And then we've got Miss Rhonda Celaire, who is the principal of Achievement Learning Center in Dominica. Welcome.
Thank you. Thanks for having us.
All right.
Thank you.
Welcome.
And then, we've got Antigua and Barbuda just representing as usual. And Miss Beverly Dabrio, CEO of Abilities Unlimited Therapy in Florida, USA. So we've got just a nice representation here for Caribbean Diaspora Vibes, and that's how we love it, right? So we're gonna go ahead and get started. We're gonna just kick off with Beverly, just to give us a kind of a summary of autism. It's a buzz. It's people are wondering how so many children now diagnosed with autism. I've even heard autism. Is this from vaccines? There's all kind of things coming out. And so we are here just for educational purposes. We're not medical professionals.
Professional, yes.
Right. We're just gonna let you know, but we want to, the buzz is there. So we want to kind of get a better understanding, and that's what the topic is: understanding autism. And if you're listening, Louis, you can give them the number that people can call in if they have questions. And
absolutely. The number out here, everybody in the studio, 407-676-9023. If you want to shout out with any questions or anything that you want to contribute to the conversation as we get started this evening.
All right. Thank you. Thank you. Miss Beverly, you are daily also in this world, and this is your passion. This is your baby. Give us a little bit about autism and just what is that?
So basically, autism is a developmental disorder, and basically children who are diagnosed with autism fit into two criteria. One, the children or the child has to have a difficulty or challenge with social communication, and also they do have restrictive behaviors. So when I say restrictive behaviors, a child may be what we may also call obsession with doing one thing and not doing everything else. So they may just focus on one set of things. So they do have those restrictive behaviors, and then they do have the social communication behaviors. They may also have verbal communication challenges. So the child may not be able to speak, or the child may speak, but is limited in their speech. So those are the main things. There are other symptoms that we can look for, but those are the main symptoms. Children with autism are very different. So, but there are about 100 or more symptoms that we see with autism. And I'll give you 10 popular ones. So number one is avoiding eye contact. And it's not just avoiding eye contact, because it can be at the other end where it's making too much eye contact. They tend to cover their ears or hit their ears, tap lightly on their ears. They like to be alone. You may see delays in our speech and communication. They may be repeating phrases. We call that echolalia, where if you ask them, what's your name? The child may say, what's your name? So they may repeat what they hear others are saying. They may get upset with small changes. We also see a lot of hand flapping. We don't know why the hand flapping, but there's certain reasons. And one of the reasons it may be is just maybe to comfort themselves or calm themselves down. So those are some of the main symptoms we may see. And like I said, there's over 100 symptoms.
Wow. So as a parent, you notice something is different with, this little one. Usually at what age can you even notice that?
You can basically notice from months, before 1 year old. So yes, you can tell, because baby before ones may have different symptoms, like not smiling, not laughing, things like that. And we also there's some genetic roots. So if there are other family members with autism, you could also take that into consideration. But definitely the signs are there before one.
For one, because most baby will start do certain things within that first year that you, the parents, will know this is normal for the child to do as growth goes by. Come in.
Right, correct, Lois. And that's one of the reasons why we miss autism, is because things like speech, those things come in when a child is 1 year old, about 12 months. So when the speech doesn't come in, that's when most parents realize, oh, something is going on, because you know, the expectation is that the child would be talking around 1. You start saying mama, papa, hi, little things, eat. So when the language doesn't come in, that's when a lot of parents really become concerned.
But they can grow out of certain things, though. This is a fact that they can, even though you might say, well, something is going on, it might be a year and some months, a year and a half. Some kids really take long to get going with certain things. But is it a fact that they can grow out of it, even though you had identified, so, well, something is really wrong, or they might have autism, they can grow out of this pattern?
Okay, so what I would say is that children, I would say it's the opposite. They actually grow into autism, because when you look at any behaviors, any actions, anything that we do, the older we become, the longer we have been doing it, the better we get at it. So without intervention, children actually grow into autism. I would say the symptoms become worse because there's nothing being done. So I would actually take the opposite approach. And as far as some children do develop at different ages, and so a child may start talking at 1, whereas another child may start talking at 2.5. But as a parent, I would always take the precaution to get help for my child, because I don't want to take that chance, because you're losing precious time. You're losing precious time. And the earlier we intervene, the better results we do have. So why even take the chance and wait when you could be wasting time? So the earlier, the better. So that's the approach I take with children and growing into it. Also, professional can, if you actually have a concern and you take your child to a professional, the professional will know, okay, these are really real symptoms of autism, or these are symptoms of just differences, like neuro differences in how the child is developing. There's a big difference. And even with language, a professional should be able to tell whether this is just a speech delay or this is a speech delay plus other things, which makes it a concern that your child may have autism.
Interesting stuff. So the whole point is, as soon as you see these things, the parents should more or less just take action or try to get advice or counsel as to what need to be done or what is going on with the child. That is the bottom line for people for kids, babies.
Bottom line, early intervention works best.
Now, you remember the days when we were growing up in the islands. We have no doctors and all of that stuff. Mother would tie up your head with something because you can't talk, and certain things would run. You know, we know it, for those of us who in the island, you know, let's talk about Christel and all these guys. A lot of you don't have the doctor, but we grew up with a lot of these symptoms. For those of us who are older and grow up and we don't talk from early, it's a lot of stuff for mother and grandmother used to do,
right,
to get us talking and get us moving. They wrap us up or whatever the case, or put coconut water, a hat on your head, something, banana, roll banana thing on your head, with something. How will we just reach this stage and we're going to the doctor? And I'm just throwing things out there. But it's a changed society, Beverly. Change altogether.
Yes, it's a changed society. And yeah, I mean, you know, if people didn't know back then and a lot of times people did do the right thing back then. You wouldn't believe, but it's not so much medical and all the medical stuff, but there's a lot of stuff that you do in the natural environment, a lot of things you do with raising your children, a lot of things you do that were great for them anyway. So even though we didn't have the medical knowledge, a lot of the things that we did were appropriate. And some of those things still hold true for today. Some of those things that we did are still true for today.
So we definitely did, I think, the holistic, even the teas and things that maybe our parents and grandparents would give us, our auntie or whoever. And so, you know, so, but, so now let's move into Christel and Rhonda, that they're, you know, they're educators at a school. And we'll start with Rhonda. So here you are, you're at your school, and have you ladies come across kids that have not been diagnosed with autism and they just were going like, you know, Miss Beverly is saying an early intervention, but what about now they get to school? Have you come across that?
Yes. So we still have that, as you say, lack of understanding of autism. We have parents in denial stages that they say, oh, my child just has a speech delay, as Ms. Beverly was saying, but the child has the other symptoms that show this is autism, and you have a few markers. You have the disassociation, you have the lack of eye contact, you have the lack of identification. As he was saying, we have a changed society. We still have parents who say it's not, people do them bad. It's witchcraft. So they will try certain things to release that witchcraft, but it doesn't always happen. So when you get that child to school and you use that holistic approach with a routine and a change of nature and nurture, the parent comes in and says, but at home, the child doesn't work like that with me. So how is it you're getting the child to do this? So then we have to tell them, well, because we monitor, we're able to assess and evaluate and build steps for that child. Because the child will behave differently at school than at home. So we have a better understanding, we have a better cooperation with the children at school than the parents have at home. Because, we're able to bridge that gap. We understand that there's a difference, be it diagnosed or undiagnosed, because some parents are afraid to take their children to the doctor to get diagnosed because they take that diagnosis as a death sentence. So we do let them understand, okay, you don't want to take the diagnosis yet, but this is what we're doing and it works for us, so you can try it. So, we do have that. We really have that. And early intervention does change lives, because here our education system is more mainstream. We do not have a lot of special education classes or assistants in the mainstream classrooms to help SEND students function as a whole. So you would have to get private to go ahead with that. And if your child just needs transition, so if some children grow into autism, but they learn to speak or they learn to do certain things, then they can enter the mainstream classrooms. But as now, we don't have much schools who would accept autism with our typical children, as we say. Is there a question?
So, Christel, you're in the classroom.
That's right.
What are you seeing?
Okay. Just to explain a little bit on what Ms. Rhonda just mentioned. I have the kids most throughout the day, and I think one of the biggest barriers we have with when it comes to autism, as she just mentioned, I think it's acceptance from the parents. For any autistic child, their journey for development, for moving forward, whatever it is, in order to move forward, you as a parent have to come on board. When you come on board and you accept, then we move on. You move on with their speech, you move on with their academics, whatever it is you want to work on, you move on. But it starts with acceptance.
Mm. So that's the biggest challenge. Parents don't want to say my child have no side effects and all of that stuff. Once you identify it in class, how do you approach it? Do you call the teacher in? Do you go to the parents' home? What is the process from there? What is the process from once you identify a problem with a child in school in your class? What is the process from there with the connection with the mother, the parent? Do you call them in and sit with them, or do you go outside to their home? And what is the process from there?
Well, as a special education teacher, I always say you have to build that connect. You automatically become family with that child, with family.
Yeah.
So you call the parent in, or you set up a meeting, you discuss the whatever it is you recognize, you move on, how we're going to move on. And you leave as a teacher, a special education teacher, you leave that free line of communication. We need that during the day, before class, after class. You have to have that free line of communication.
Mm-hmm, mm-hmm.
You know, I'm gonna repeat some of the signs that Beverly talked about. So people, I think it was constant rocking, covering of the ears, maybe not being doesn't like to be touched or hugged, little eye contact, obsession with specific toys, spinning objects, delayed speech, poor social skills, sensory challenges, difficulty making or keeping friends, does not smile a lot, walk on tiptoe, difficulty adapting to change, flapping of the hands, constantly repeating the same sounds, spinning in a circle and lining up toys. So those are some of the signs that if you're seeing, you know, with your child and you pay attention, you know, we also have to be in a space now, because, you know, we easily give these kids the tablets and things like that. But we have to learn we have to be, you know, more hands-on to watch the child and see what's going on and see if the loud noise, you know, is bothering, and stop yelling at the kids if that's the case. Like, why are you covering? You know, we know Caribbean people. I can't say for anybody else, but we know Caribbean people, Caribbean heritage, parents, grandparents, the child may be exhibiting signs like this, and then they're going to get yelled at. They're going to get yelled at, you know, if they don't understand. So it's so important to have this kind of training to the extension in the family, like not just mom and dad, but whoever the caregivers are in the family that's going to come in contact. Because can you imagine the child is experiencing these things, not able to express, and then the adult is punishing the child for this, which I think this happens a lot. So is there any training that Beverly, do you do training for caretakers?
Yes, I do training, and all caretakers get training, who I work with, of course, and consultation also. So definitely that is a big part of the whole intervention process.
Okay.
And because I'm not there with the child all day, so I have to show them what are they going to do when situation arise.
Right. And then Miss Rhonda said that a lot of the times the child will behave differently with, you know, someone at school that's trained versus maybe being at home.
Mm-hmm. And that would be my next question, guys, and anyone can jump in and answer it. Is there are they emotionally different from the rest of students in terms of do they show more emotion in the class or less emotions?
It depends. It highly depends. So as Ms. Beverly was saying, you're training, but most times females with autism suffer the most because females have the ability to mask. So as Ms. Donna was saying, you know, we cover their ears and we shout at them. But most times a lot of girls with autism have speech, but they do feel that they do have a bit of the antisocial. But when you shout at them, they realize, okay, maybe I shouldn't do this anymore. So they grow up their life masking what they're supposed to do because society tells them to do it, but that's not how they feel they should act. So the Caribbean heritage again causes a lot of Caribbean females to be undiagnosed with autism just because they can, we probably have a few friends, have a conversation, but they do have autistic. They're somewhere on the spectrum, like fully functional. We call them high functional, but they're masked because from a young age, basically, we mold them to be what we want them to be. But behind closed doors, they're a different person. So every child with autism is different. So if you cannot speak and you're tired or you're hungry, you can do a few things. You can cry, you can have a tantrum, or sadly, you can attack somebody else. Mm-hmm. So it's you as a professional in the classroom setting to know, okay, I think somebody might be angry or how they came in today. So you have to really study that child. As Christel was saying, you have to have that free communication. So the caregivers or the parents would have to say, Miss, this morning was a rough morning. And sometimes it could be because you gave them the wrong color cereal. So you have to mention that because you're putting others at risk and children set off each other. So if one child is having a meltdown, then you can have several having meltdowns at the same time.
Same thing, pattern.
Okay. As far as girls and boys and the differences with autism, the boy seems to have the more outright symptoms, and the girl seems to have the lighter symptoms of autism. So many times a boy is more likely to be diagnosed. That's why we have a higher number of boys having autism than girls. But the girls do have more of the lighter symptoms. So that's the difference in boys and girls. Go ahead.
And when you say lighter, you mean they might have the same issue of okay, so you're talking about one, the boy would scream louder if there's something going on in the school, while the child, the girl would more be passive then. That's what you're saying.
Yes, the boy would more, yes, exactly.
More aggressive. Yeah.
Yes, aggressive versus maybe depressive. So the girl may even show be sad while the boy may be angry. So symptoms like that you will see more in boys, the more pronounced symptoms. And also those symptoms tend to be more concerning to parents and concerning to teachers, and maybe even more disruptive in the classroom setting. So a lot of times the girls may go, get ignored or go undiagnosed because the symptoms are lighter.
Lighter. They more keep it in than expressing it out to the parents. Let's talk about the positive side. Do you see any special talent in these people who are diagnosed with these problems? Some of them exert special talent that you pay attention to, that you see that they exert in their class, and how do you deal with that in terms of developing that talent?
So I just want to mention that children with having behavioral challenges or aggression or misbehaviors are not a symptom of autism. That's not a core feature of autism. Yes, some children with autism may have those behaviors because of many reasons, too much to discuss right now, but it's not a core symptom of autism. So children with autism tend to be very compassionate. They tend to be very caring. If you see a child does something and it seems to be willful or trying to irritate you or trying to make you upset, usually that's not a symptom of autism, and that child may not even have autism because the things that they do are not trying to be willful or trying to harm anyone or trying to be spiteful. So the things that they do are basically trying to have their needs met or trying to comfort themselves. Those are the things and the reasons behind the things that they're doing. But they're not trying to hurt people or make people lives miserable. So just to mention that. Another good thing about children with autism, besides being loving and caring, is that they a lot of times have special talents. Like they may have super memories or they may be good with chemistry, good with mathematics. They tend to be good in geography. They tend to be skillful in music. So basically a lot of skills, uh, a lot of skills that takes focus and careful attention, because what we have to remember in with autism, when we say deficits, it's not only deficits. Sometimes it will be excesses. So sometimes they're doing it not enough, but sometimes they're doing it too much, which could be a benefit, right? So if you're trying to learn something and you really get obsessed with it and you really get hyper focused and you're doing it too much, you can really become an expert at doing it. So the same things that, you know, that's a negative for them can also be a positive for them.
Interesting.
Anyone
It's interesting to just it's interesting, you know, I would love for a parent to because I know it's not always easy. I've heard different stories. Like you said, we had a rough night or something could trigger that child as the wrong color of cereal. So, wow. You know, so I'm sure so what advice do you give parents?
There are, okay, someone else can go, then I'll go.
Christel.
Sorry about that. It is stick to routine. It is very important. Students, children with autism thrive on routine. So it's very important as parents and teachers to stick to your daily routine. And if there are any changes to their routine, you explain it to them. You don't just throw it in your face, no. Because that can throw them off. Back to the cereal. The wrong cereal in the morning can carry out all during the course of the day.
Wow.
So you got to get it right from morning.
Yeah.
And yeah. like Christel says about the switching up, you know how sometimes we just say, we're not doing this, or we're not going here, you know?
You can't switch up on them.
We can switch up, but let me say this, we have to do it strategically. So we can't just decide, okay, I'm going to switch. We have to do it in steps, right? So there are ways that we get them to tolerate different things, but we do it in incremental steps. So we start by, you know, we design something where you get let me see. So where you start out with a little bit, maybe, so if they can't tolerate, they only want circle cereal, then maybe you give them something that is a circle, but it's not exactly 2 round as a circle. So you're moving them in little steps to tolerate more shapes or colors or textures. So if the child doesn't want anything but red cereal, using cereal again, you may try to move towards an orange or a pink. So you want them to tolerate these things, because ultimately you're not going to be able to design the entire world for your child. And if you think you can only give it. So I know children with feeding problems, they only want to eat peanut butter every day, right? That ends up creating another problem, because your body's not getting the nutrition that you need, right? So that creates another problem. So we have to take our time, have step. If you have someone you can work with, like behavior analysis, that's how we get them used to things. So instead of avoiding things, we use small steps until they can tolerate those things, because we don't want to limit their world. We don't want to say, okay, you can just go to school and home. We want you to be able to go to the restaurant. We want you to have a full life and to be able to participate in life just as every other child. We want you to have those opportunities. So we're going to give it to you in small doses until you can tolerate it. That's
So that's very interesting, because someone not understanding this, especially before diagnosis, right? And changing up stuff and wondering, why is this child being bad or this? And so it's so important to pay attention and just see what the triggers are, see what's going on. It's those little things that could probably go, what? When I give him this, he freaks out. Or if I say we're doing this now, but even bedtime routines, morning routines. I hope there's a support. I'm pretty sure there's a support group, because I know it's not easy for that child, and it's definitely not easy for the parents, right? To have to, do this extra step, especially if you have another child, and then that child is like, you just tell him or her one thing and it's fine. Do you all offer support groups? Or
Yes, we do. So Achievement Learning Center is under an NGO. So what we did, we created a parent engagement group. We call it PEG, like a close PEG. So basically to hold you together. Sometimes you just need a little help to hold you together till the weekend comes. Because we noticed that there are a lot of children with autism and other disabilities that we kind of cater too much in our education system. So we get them together, and PEG was just a little social experiment. And now PEG is regional. We have members from Jamaica, Guyana, and all these things. And they are here spreading, what works well, what works better, what can you try? Because at the end of the day, while parents have a certain relationship with teachers, when you're a parent yourself with a child with special needs, and you hear another parent talking about the same thing, you almost have a better bond with that person just by association. So what we do is we host a lot of trainings, so much so that we saw a need and we developed a sexual health education curriculum for children with special needs, because we do not have that. So we developed one like this. It's the only one. We're gonna get it out to the other Caribbean so they can use it, because you have children with autism, they cannot speak, they cannot self-regulate. So you have to teach them how to do these things. You have to teach them safe places, safe touches, and all these things that are not part of the regular curriculum. So we have found a gap, and we are working to fill that gap, because while these children have autism, their hormones, or their sexual beings and tendencies do not have any deficiency. So you have to teach them from small. So we do offer training. We work a lot with the Nathan Ebanks Foundation and UNICEF and all these things. So we do get a lot of training. And as you said, it's all to who really wants it and who comes forward. As they say, you can bring the horse, but you can't force it to drink.
Right.
So we do give them as much as we can, and then it's up to them to absorb as much as they want.
Would you say artistic, and anyone on the panel can answer, would you say artistic individuals are more honest, more straightforward?
Yes.
You know, more genuine than
Yes.
regular people?
Yes. Because they're asking the reflection, so it is them. That is them. And you cannot tell them they did that brushstroke wrong or they carved it wrong. You cannot tell them that. You have no influence on what they're creating. So people who are artistic are from a different cloth. You cannot crush them, twist them.
Yes.
They will do exactly what is coming from them. They cannot change that, you cannot fake it. So they are stronger and they're a little more bold, as I would say.
Yeah,
that's good to know. That's really good to know.
Go ahead.
They're definitely more honest. They say what they see. So sometimes it doesn't work out too well for everyone. So for example, a child with autism, if you're gaining weight, they will tell you, you know, Miss Beverly, you're looking fat today. You know, they just tell you straight as they see it sometimes. So yes, they're definitely more honest and they say what they see.
Wow.
So it's just a big is again, like everything else, is a lack of education for people around them to understand who these people are. Because a lot of us don't know these traits about artistic. I mean, we hear the term artistic or autism, and we immediately our mind go negative, that this person is a bad person or is not a good person or is not the best to hang around with. But once you start really understand and read up the symptoms and the benefits and the trait of these individuals, there are some real good people. And I think a lot of us as people, we have a big misconception, big misunderstanding who these people are.
And like you said, Lois, there's a lot of talent.
Yeah.
Because as Beverly said, when they go in on something, they do it repeatedly, where the normal child may be like, oh, I'm not going to do that, but they're going to hone in on that skill. So there is a lot of, we see a lot of talent and just genius sometimes with people with autism. So I think it's just those other parts, like you said, like changing up cereal. You have to learn about them, right? Because now it's a different daily routine for that child versus the other child. So you then now have to kind of change and learn and adapt, be more patient, be more understanding. And you know, as parents, when we're trying to get out the house in the morning, we just tell them, grab this, grab that. No, you know, so I'm sure it's completely different in a household with an autistic child, where you have to get your bearings, be calm, understand, you know, the child and what's going on. So it probably teaches us as caretakers, as educators, to be a little bit more patient in this world too. So as we come to the last almost 15 minutes, let's give some advice. We'll get some advice from Beverly and then Rhonda to that person, that parent caretaker that just found out. They kind of had an idea, but they just got an official diagnosis of now you have a child that's autistic. What would be your advice?
So they have their diagnosis already. So Usually if you get a diagnosis, you want to ask the person giving you that diagnosis, you want to ask them for a referral to seek intervention or therapy. They may give you speech therapy, occupational therapy, and most of all, behavior analysis. So ask them for those resources, ask them for state programs that may be available for free. Ask them for the people in the school system who is able to help your child, whether it's with getting services or getting an IEP, right? With getting an IEP. So you want to ask for some numbers and some people you can reach out to. That will be your first step. Be careful about going online. If you go online without any guidance, a lot of times you will find a lot of quack treatments. There are a lot of quack therapies out there for autism. And these therapy waste your resources, they waste your time. And like I said, early intervention is very important. So if you're getting a quack treatment or quack therapy, your child is just getting older, but no improvement is being made. Any therapy or any intervention you find for your child should be focused on teaching your child skills. Plain and simple, you want your child to learn skills. If your child doesn't know how to do something, you want your child to do it. That's the bottom line. Changing your child's brain, changing, all that doesn't work. It doesn't say, you want to see your child learn actual skills, because autism, the only part about autism that makes it stressful for families, makes it not optimal for kids, is the fact that they don't have certain skills, and also they may lose certain skills. So that's the difficult part. But your child is just a child like any other child, and autism is a small part of your child. Autism is not your entire child. So to try and set up something for your child that is addressing your child and addressing autism is really no use. You need to teach your child skills and let your child just have a life like any other child without autism. That's my advice.
Amen.
Thank you. Rhonda?
Sure. So my first thing will be to breathe. You have and that parent guilt, let it go. Because a lot of parents say, oh, what did I do to have caused my child to have that autism? What did I do? Was it because I stayed up late? I ate this, I did that. Breathe. It's not your fault. There was nothing that you did that caused the autism in your child at this point. So in addition to what Beverly was saying, there are a lot of WAC treatments. Get to a professional. Find a support group. Find support also in your family and involve your external family. Because what we notice a lot of time is that the parents who are directly dealing with the child with autism, they have no support themselves. You owe yourself a spa day. You cannot fall apart and try and help your child. You need self-care just as much as your child needs the care. You need to be strong so that your child can be strong. Children with autism know when you're sick. You know when you're not well. So the child needs to feel that spirit as they grow up. They need that comfort, they need that strength, they need that support. And they also need friendship. So they need school. Despite them lacking the skills, you still need to give them the opportunity. Not too much to overstimulate them, but you still need to give them the opportunity to be in an environment that encourages them to do different things. Because we notice that children play with each other, surprisingly, and they will do things with other children. So you observe them, you assess them, and you keep going forward. If the child is not academically inclined, as in you notice like they're so far on the spectrum, then you look at functional skills. If the child is lower on the spectrum, but you have that muscle tone, you have that memory, you use that. You never say the child can't do that. You just try. So brave, try, get support, and take care of yourself. Most importantly, that's what I would say.
Thank you so much, Rhonda. Christel?
Patience. It is one thing having an autistic child. Teaching patience.
Have patience.
Patience is crucial for any autistic parent. You will make mistakes. You will get frustrated, but don't need to hard on yourself. Practice patience and understanding. And your child will become a little more comfortable. Get your support group. I remember a parent said something one time on that talk with me. When you have a child, you have a village helping you raise that child. But when you have an autistic child, you become that village. So it is very important as a parent of an autistic child to find that niche, find that group, find that support system, because you will need it.
Thank you. I hope before we sign off with the Rhonda mentioned something, and I think we just want to touch base on it. Spectrum. There's a spectrum of autism. Rhonda, can you kind of touch base with that?
Yes. So long ago, they used to say autism, but what they've realized is that autism is a spectrum. You can be very mild on the spectrum, or you can be very high on the spectrum. So you can be extremely low functioning. So that is very limited movement, like they're literally afraid to fall. So they don't walk that much. You have no speech, low muscle tone. A lot of the musicians now they're saying could have had autism because of their ability to listen to different keys and pitches that normal ears cannot hear. So autism is a spectrum. We no longer say, okay, we have different levels. So if you can do certain things or you can do not. You can either be extremely well, like we have the savants who are music, maths, chemistry, physics, engineering, these children and these adults. That is all they can do. So that's their hyper focus. Without that, to them, nothing else matters. But we have those, like how Miss Beverly was saying, we have those with the milder symptoms. They are in our society every day. They take the same bus. They take the same route to work. They have clothes Monday, Tuesday, Wednesday, Thursday, Friday. They will not change that outfit because that is how they have it programmed in their brain. Some people might say some people with autism have OCD because if you move their stuff, they know you moved it and they want you to just put it back. I will say, oh, but you just moved that. And no, you need to put it back in the same mark. They need to have certain levels of structure to function. So as we're always saying that early intervention matters because you can build a routine from 3 years old and that child will move on. And if you have the interventions that you need, your socialization, for some people, they do some supplements. I'm not too sure how they do that toxic detox, as they say, with heavy metals and stuff. But for some people, when they do some tests, they do have heavy metals in their system. So sometimes it allows them to feel a little better. They may not cure, they will not cure, but certain health issues they may have do disappear. And like gastro issues, because we know a lot of them have food sensitivities. So, you have to, so the spectrum is a range. There is no one way.
Right.
So autism is a range. That's why we use all the colors. So it's a range. It's not one size fits all.
Thank you.
Right.
1 minute, 30 seconds. Do you have Ms. Beverly, did you have any input on that spectrum or?
Yes, it is a spectrum. Yes, she's correct. And Yeah, pretty much she said it all about the spectrum. They used to have different where they would give different diagnoses on the spectrum, but now they just diagnoses and give different levels instead of different. They had different disorders like Asperger's and other ones, but they just combine everything into one now, and then they'll give you level 1, 2, or 3, depending on your functioning. So yeah. And yeah, and like everything in life, right? We begin to realize that everything in life is a spectrum. No matter the disorder, it's a spectrum. As far as I just focus on teaching skills and reducing challenging behaviors. So any behavior that would get in the way of a child learning skills. As far as the other stuff like the supplements, I don't get into that because we all know children with autism, they can have other things going on too, right? So not because you have autism, it means you doesn't have another thing. They have other medical conditions going on. So I usually leave that up to their doctor to work with those medical conditions and the supplements and stuff. Yeah.
Okay. Tell us, Beverly, how can people find you if they want more information?
My email is the Dabrio, TheDabrio @yahoo.com. And if you put my name in Google, I'm sure you will find me somewhere. And my website is abilitiesunlimitedtherapy.com.
Wonderful, wonderful. Hopefully because I know Rhonda mentioned collaboration in Jamaica and different places. So maybe you guys can connect off screen to see how you can continue to bring this awareness and
Yeah.
let us know if you want to host something again later on,
Yeah.
on Caribbean Diaspora Vibez, because this information is vital. Rhonda, tell us about your school.
Our school. So we're a special school, and we're also private, because of, we also have to deal with the confidentiality needs of some parents. They do not feel comfortable with the children being. So we are that. We're also under an umbrella of an NGO. So we are Achievement Living Center. You can find us online as well. Our director is well known, Beverly of Dominica. She works a lot with the Disability Network of the Caribbean. She does a lot of work with OECS, UNICEF when it comes to speaking and developing policies for special needs. So once you type in Beverly Libla, you will find her. You'll find us at the Achievement Living Center and Circle of Friends. So we are here. You'll find.
Thank you, thank you, thank you. Lois, I know you've got to jump off.
Yes, I just want to say thank you, ladies. It's been a very informative session. Beverly, Christel, and Miss Rhonda. Excellent information. And I know our listeners out there who have these issues with kids and other people will certainly benefit from your knowledge and experience today. Thank you, guys. Dr. Adams, a pleasure having you again this evening. Donna, we'll catch up next week at the same time. And what is the topic for next week? You know yet?
Next week, we're going to switch around because now we've got, we were supposed to talk about consequences of alcoholism, but we've got to switch around to accommodate the Haitians and Jamaicans advocate, so we'll be meeting in person next.
Yes, Jamaicans for Asian refugee. And we're inviting all our Asian brothers and Asian sisters and Jamaican brothers and Jamaican sister to meet us right here at 721 Verona Street next Tuesday at 6:30. We're going to talk. We're going to figure out what to do with our Asian brothers as refugee in Jamaica. God bless you. You guys have a great evening. Soccer Ed Ball Talk coming up next. Have a good one.
Thank you. Have a good night, everyone. Appreciate
night.
it.
Everybody.
It's everyone.